right, well, hello everyone. Thank you so much for tuning in to our virtual career exploration series. We are on our final month, and today we are joined by Tony. Is it Verhan? I need to redo this. Verhan?
Good job.
Verhan. Okay, I need to write the Ver.
Like Verhand, Verhand
Yeah.
without a D at the end.
Yeah. Okay. I don't know why I stumbled on that. Okay, let's stop. Or let's start over. Okay. See, I'm the one goofing up. You'll be great. It's me that needs the practice, I guess. All right, welcome everyone. Thank you so much for tuning in to today's virtual career exploration series. Today our topic is Certified Nurse Aide, otherwise known as CNA. And today we have Tony Verhan here to talk about his role as a CNA and share a little bit more about the career path that he took to get here and all the ins and outs of his role at ProHealth Care. So Tony, I will turn it over to you and you can share more about your role here at ProHealth Care.
Wonderful. Well, thank you for the nice introduction. Hi, everybody. Um, I'm probably not what you would typically associate with a certified nurse assistant. Um, yeah, I've been doing this for about a year, and this was really, in a way, a third career for me. And it's probably the one that I love the most. So, as far as my educational background goes, I have a bachelor's, I have a master's degree. Um, Early in life, I was in the military and I wanted to pursue a career in the Army. Um, Things kind of changed along the way, and I ultimately wound up getting into the employee benefits industry. And I spent 30 years in that field. Um, I did a lot of interesting things, wrote and published a book, lobbied on behalf of the industry on Capitol Hill, sorts of interesting things that I never imagined that I would do. And yet I never quite felt like I fit in or that I was serving sort of a bigger purpose. And I can tell you that in the last year here at ProHealth, working as a certified nurse aide, I have found that. And I love it. I enjoy it. Um, I ultimately chose to become a CNA because I knew that I wanted to pursue nursing as a career for the last 10 or 15 years, my working years. And the CNA, it gave me an opportunity to sort of uh, get my feet wet, really gain a lot of valuable experience um, while I go to school. So while I'm working here at ProHealth, Waukesha Memorial Hospital on the fifth floor, I'm also going to school. I'm enrolled in the associate degree in nursing at Waukesha County Technical College. So anyway, that's a little bit about me, and I was asked to talk about, you know, this role and what I do. I know that there are people, some of my colleagues are doing this while they're in high school. They're 16, 17 years old. They know or they think that they've got an interest in becoming a registered nurse. Um, and so they're doing the CNA job as a way to get their feet wet. There's other people that are doing this later in life, just like I am. The certified nurse aide is a healthcare professional who provides basic care to patients under the supervision of a registered nurse or a licensed practical nurse. Here at Waukesha Memorial on the fifth floor, it's just registered nurses, and they're really the backbone of the organization, the backbone of the hospital. Um, they're really where, all those things that are talked about by doctors and specialists, the specialists, the RN is who ultimately executes and makes all these things happen. And the certified nurse aide is someone that supports the nurses in many of the tasks that they're responsible for completing. So a nurse aide, you'll find them oftentimes we're associated with being in a long-term care, skilled care facility, assisted care, that sort of thing. Um, basically a retirement type setting. And that's not at all what our setting is. We're a hospital. We tend to take care of a lot of different types of patients, lots of different needs. And so the care that I provide as a CNA is very different than what you might see in a nursing home or some of the other settings that I mentioned. But there's tons and tons of careers in this field. Again, it's entry level, but a lot of us are looking to do something, something else, like me with being a nurse, and that sort of thing. So, at any rate, I think this quote by Martin Luther King does a great service to the role of the certified nurse aide. And he said, no work is insignificant. All labor that uplifts humanity has dignity and importance and should be undertaken with painstaking excellence. In other words, there are no small jobs. And when I look at, who we serve and who we're trying to help, at least on our floor, medical surgical floor, we're serving young adults to the elderly. Probably the youngest patient that I've served with in the last year on this floor might be a older teenager. But then we get patients that are centenarians, so they're 101 years old, all types of socioeconomic backgrounds, which leads to a lot of really interesting conversations with patients. All different cultures, ethnicities, multiple different languages. So you're always on your toes. It's always interesting, just starting with the types of people that you're dealing with. And then there is their needs as a patient. Some of them are acute. They might have done something at home or done something at work or whatever, and they need acute care. They might go to the emergency room or the ICU first, and then if they need sort of a little bit longer care, a day or two in the hospital or a week to recover, and to continue to get treatment, they might come up to our floor. Similarly, if they've got a chronic condition where they need some kind of a surgery or procedure, and maybe it's a combination of both acute and chronic, they might end up on our floor. Again, it can be for a day, it could be a week. Sometimes we have patients who are up here for many, many weeks or months. So it's a very diverse population with diverse needs. Again, I put this in contrast to some of the other CNA opportunities that are out there. This job is never boring, and the patients are always changing, which is pretty exciting. The typical duties that a CNA on our floor will perform during a shift. I'll use a day shift as an example. So we start by entering a room. Patient might be awake, they might be asleep, but we introduce ourselves. We get their vitals. That means their blood pressure, their heart rate, their temperature, their oxygen saturation rate. We also do a blood glucose check if they are diabetic or if there's some reason that we need that, we'll also do that. So that's a little bit unique from other CNA jobs because you're starting off the morning by gathering assessment data that the nurse will use. After you get that done, then you do some early morning patient care. You might be helping them eat, you might be helping them to the bathroom, you might be helping them shower. It goes pretty quick because then you have some other things that tend to be kind of unique, very specific to that patient. You might have to get them ready for a procedure. So that might be a special kind of bath or special kind of cleansing. Before you know it, you're hitting a point where you need to now go around and get more vitals and do your second blood glucose check. Later in late morning, around lunchtime, you're starting to help people just do typical things they might be doing for lunch, but they can't do it the way they would normally do it because they're not at home. So you do that, and then in the afternoon, you're doing other things that you might be helping the patient, after they've seen their occupational or their physical therapist. You might be just getting them waters, doing simple things. And before you know it, 8 hours or 12 hours has passed, and you are now preparing to hand off your clients, your patients, to the next shift. The day goes fast. It's always interesting. In between those basic phases that I just laid out, we might be bringing in new patients. We'll get a phone call that we're supposed to be admitting a patient to a room. So we'll prep the room. When the patient arrives, we'll help the patient get into their bed. We'll do a whole set of vitals and provide that. All that does is provide information that the nurse uses so that she or he can do their assessment. We inventory their clothes. It could be inventory their money. We can do a lot of different things associated with just the basic admission into a hospital room. We'll be preparing patients for CT scans and different types of scans. And every time you do that, you're learning something new about what your teammates in the hospital do. You're transferring patients. When they go down for a procedure, you're helping transfer them down. When they're coming back from a procedure, you're helping them get back into bed or get back into the room. You're always monitoring your patients, whether it's just your own eyes and ears, or it's using different types of technology. You're always monitoring the patient, their status, their alertness, their comfort level, the pain level, and you're reporting that to your various teammates. You might be helping your therapist, the occupational physical therapist, just with basic mobility things. Along the way, you're always documenting the information, which is important because there's got to be a track, you've got to keep track of everything that you've done. It's not painful to do. It's really important. It's essential to what we do. Again, because as a nurse aide, I'm really supporting the nurse in her or his function. Along, in that same vein, I'm also reinforcing the teaching that they do. And then when a patient comes in, we're already preparing them for discharge. So as a nurse aide, I have the privilege of not just helping these patients into the hospital, but I have the privilege of helping them go home or helping them to the next stage, which is ultimately what we're all trying to do. There are a lot of different tools that we use as a CNA to make that all happen. And some of it's real basic. You use a hospital computer. We're given hospital phones that are connected to the computers so that we can touch base with people on our team easily, and they can touch base with us. But we also use like the vitals cart. It's called a Dynamap, and we will take that into or out of every room that we go into, and that's how we gather that basic vital information. Again, heart rate, blood pressure, oxygen level. We also have glucometers. Sometimes a patient has their own glucometer, but when you're in the hospital, we have glucometers that we use that are linked into the rest of the computer system. It doesn't sound too interesting, but when you think about how everything is so interconnected, and when you think about your role as a CNA, you really do, if you're looking to, either work as a CNA and get more experience or become a nurse at some point or another kind of specialist, it's a great way to get a sense of how all these things are interconnected. There are monitors. Many times a patient will be on a heart monitor. We call it telemetry. We might be constantly monitoring their oxygen level. We call that a pulse ox. Or we might have a camera in the room to make sure that when nobody else is there, the patient is safe. We call that an aid assist. We use other things like bladder scanners and different types of beds and chairs and devices to move a patient, to transfer them. So when I was I started a nursing program elsewhere, and I really didn't feel like I had a deep understanding of what it was like to function as a contributor in a hospital setting. So ProHealth was gracious enough to, give me a job opportunity and train me and that sort of thing. And I think this has been one of the most satisfying parts in a technical way about doing the job. I get to see and use all of the equipment, and I get great training before I ever touch a piece of equipment. I become plenty familiar with it, so it gives me a little bit of an advantage as a nursing student because none of this is new to me. ProHealth has trained me how to use it. The nurses have trained me how to use it, and I really do know how to put it to good use. To become a nurse aide, you need a high school diploma or equivalent just to get started. You need to obtain your certificate. In order to obtain your CNA certificate, you have to go to an accredited school. Technical college, I think, is where most people go to school for this, but you can also do it, I think, here at ProHealth. You take courses, you have to satisfy some basic state requirements as far as the amount of time that you get training. I think it's right now it's around 90 hours of time between classroom and on the job working in a clinic type setting. And then once you complete that requirement, you take some tests, like basic tests in the classroom, you're issued a certificate. That's not the last step, though. You also have to get your license. So in order to get your license, you have to pass a state exam, and it's a 30-minute exam where they basically have you perform skills that you would normally perform in in your job. Once you pass that, then you earned your license. So it's really not the threshold to become a CNA is not terribly high. But once you're in, there's so many opportunities. And if you go to work for an organization like ProHealth, you get a lot of training before you're ever put in a position where you're, like on your own providing care. So here at ProHealth, they provide us with 5, 6, 7 weeks of training. It's an orientation period where you learn a lot of this stuff. You've got an education coordinator who puts a program together that's kind of tailored to you and the job. And then you get these wonderful preceptors or teachers. They're people that are actually doing this day in and day out. And they have volunteered to teach a new CNA, someone who's just licensed without much experience or even with some experience, and they get them acclimated to the floor and all those different duties and responsibilities. It's a phenomenal way to learn, and it's kind of, there is some pressure, but it's really so guided and so purposeful that it's rare that I think you wonder, am I going to make it? So anyway, it prepares you very well for what you have to do. I think some of the softer skills that you want to have coming into this job as a nurse aide, in particular on a floor like 5 med surge, you have to be good at multitasking. It's not necessarily something you have to be great at before you start, but you'll become really good at it. You're never alone. And on 5, on our floor, we have this wonderful thing that on 5, we never let anybody drown. And what we mean by that is we're as a team, we're all supporting each other and we're looking out for each other's interests, patients, that sort of thing. But you have to be able to multitask and really move efficiently. That doesn't happen on day one. And you're given a lot of latitude here, a little, like a lot of time to really kind of find your groove. Because once you get that groove, you're serving 7 or 8 patients in a shift or at a time. You're working with sometimes 4 different nurses, and all of them, patients and nurses, are relying on you to get all your things done. And if you want to kind of a recap of what all those things are, you can look back at the beginning of my presentation. So you also have to be adaptive. Things can change very quickly, whether it's your patient status or getting a new patient or being asked to do cover for someone. There's lots of different things that can happen. A patient can suddenly have a crisis, and you have to be able to support the care for that patient without losing sight of the care for your other patients. It's pretty exciting. I come in sometimes a little bit nervous. I always leave feeling like I gave 110%. I always feel good about what I delivered. Part of that is because I've learned, I've gotten much better at multitasking and more adaptable. And then the last soft skill that I think can be really valuable is for someone like me, second or third career. If you come from a service industry background, this could be the ultimate service job for you because you're constantly building relationships with your teammates and with patients. addressing their needs and trying to help them feel more comfortable, making sure they get what they need, that sort of thing. It's just, to me, it's the ultimate service job. And we work, if you're interested in this job, I work days, but you can work at any time of the 24-hour clock. You can work days, PM shifts, or night shifts. You can work 8-hour shifts or 12-hour shifts. I do both. ProHealth has kind of allowed me, being in nursing school, to build a schedule where I work 12-hour shifts on Fridays, and then on weekends I work 8 hours. It works really well for me. And that's again one of the benefits of this job, is you can really tailor your schedule to meet your needs. We have plenty of people here who have families, nurse aides who have families, and they prefer to work just weekends, or they prefer to work just weeks. There's a lot of flexibility in the schedule. I put a comment in here about start and end times. We typically start at 7, 3, and 11. That's typical. But sometimes you can start at 11 o'clock in the morning, or you can start at 7 o'clock at night. That does vary. If you work in our ER or our ICU, they have very different rotation. And so the point there is that there's a lot of flexibility. Once you're a nurse aide, once you're working for an organization like ProHealth or working for ProHealth, I hope you do, there's a lot of opportunities to customize your schedule. And then there are just tons of opportunities. You can work in heart care, you can work on med surg, you can work in the ICU or the ER. Just so many different places that you can work. And if you do a good job, if you hustle at this, and you're competent, you'll have no problem finding new opportunities if you want to find them. Why do I enjoy it? I enjoy this job first and foremost because I really feel it's a noble purpose. In my prior career, every now and then, someone would refer to me as a Samaritan because I would do something nice for people. I was always looking to do nice things. And in the service industry, sometimes it would be looked at like you had an agenda. Here, there's no agenda. I get to be as kind and charitable as I want to be, and it's just part of the gig. So I really enjoy that. I don't think there's anything more noble than caring for people who can't care for themselves and really need a hand. It's never boring. I say rarely boring in the slide, but it's never boring. Again, you come in at the beginning of a day kind of wondering, what is the day going to look like? What's the first hour going to look like? And by the end of the day, you have a clear picture. You go home, sometimes exhausted, but always satisfied. And that's not just me saying that. That's almost universal. The people that I work with on 5 med surg, they all say that. And that brings up teammates. These are the nicest, finest people that I've ever worked with. I look at my military background, and I see a similar, kind of commitment to the team, commitment to excellence, never letting your teammates down kind of attitude. And they're always teaching me. I love that. There's an unselfishness in this group, which leads to personal fulfillment. I think, of all the things I've done in my life, this is probably the most fulfilling. And sometimes it's, it can be the grungiest, helping someone get cleaned up after, they had an accident. That could be a little bit distasteful, but man, they're hurting. They might be embarrassed, and it makes me feel good when I just say, hey, it's no big deal. This is just how part of the bodily function. This is a great opportunity for someone that, like myself or like you, who might be looking to go on into a nursing career or some other healthcare career. Maybe you want to be a physician. Great opportunity to get a ground level perspective of what goes into providing healthcare in a hospital setting. I always have opportunities to be the difference. And the organization and your colleagues will recognize that. So every now and then I do something small for a patient. They might need glasses, and I'll give them my glasses, or cheaters. I came in and on Thanksgiving, there was a patient of mine. I knew that she was going to be lonely on Thanksgiving. Her family all lived away. And I just came in to just cheer her up. A couple of my colleagues recognized it and submitted me for an award, which was not anything that I ever wanted to do, but they recognized it. And at the end of the day, that felt really good to be recognized for just helping somebody out. Not because I was looking for recognition or you'd be looking for recognition, but because it's the right thing to do. And that makes them smile. That makes me smile. And at the end of the day, I think that's pretty special. I am a huge fan of ProHealth Care. I'm grateful for ProHealth giving me the opportunity to get started in this career. I like ProHealth Care because it offers the best of both worlds, in my opinion. I've worked for large organizations and tiny organizations. And at ProHealth, we have all these resources and opportunities that you find with the big organizations, but I can go anywhere and people know, my teammates know me. Sometimes I float over to our other facilities, like Oconomowoc Memorial Hospital, which is where I'm doing my student nursing clinicals, and people know me there. It's so familiar. And you're always bumping into people you know, always a smile, always a hello. So you always feel valued. There's also that community connection. And most of our patients are from Waukesha County and the contiguous counties. But there's never a doubt in my mind who ProHealth is serving. And it's people in this area. And the people, my patients, I know that they feel the same way. They want to come to ProHealth. They want to come to Waukesha Memorial because they know that they're going to be treated like community members here. There's plenty of opportunity for growth. ProHealth has a strong reputation. My wife is also in healthcare, not at ProHealth. She's with another hospital, and she reaffirms that all the time. That ProHealth is very well known in the community, the region. And then there's just the exceptional people. I am blessed to be working with them, and I feel lucky to be one of them. So that's it. I hope that this has helped you. Again, great organization, great opportunities, great people. I hope you join us. Thank you.
So much, Tony, and thanks again everyone for tuning in today. We hope you've been able to check out some of our other videos as well as we wrap up this virtual career exploration series. Take care and have a great day, everyone.